public meeting. First item on the agenda, approval of the agenda. Entertain a motion for approval.
So moved.
Any discussion? All in favor?
Aye.
Public comments. Public comment. Each individual will state their name and have 3 minutes to address the board. You may only address the board once under this public comment opportunity and may not yield your time to others. Board members will not debate or answer questions at this time. Public comment.
Hello, Commissioners. Can you hear me?
A little bit louder, please.
My name is Rick Seegers. I live in Jackson County. I've been employed for 36 years full-time, 10 more years part-time with the Parks Department, Cascades Golf Course. I have been on the Senior Advisory Committee. My term is up. I submitted another application to be reinstated, and I'm hoping for your support. And I brought some flyers. I don't know if they're allowed to take these or not.
You could present them to the,
Most of the receipt.
These are from the,
Aye.
thank you. I'd like to pass these around. Please, that's the kind of activities that we do out there.
Thank you.
Thank you. Oh.
Good morning, I'm Kenny Price. I'm an immigrant to your country, and I am a member of the Department of Health Services Board and the Medical Care Facility Board, and I'm reapplying for that. I have been on it now for two terms and a partial term. I have enjoyed being on there. I have learned a lot. I still have a lot more to learn, as everybody does at the two facilities, but it's a great deal. And I should be reappointed because I'm the only good-looking Texas boy on the committee. Thank you.
Did we skip over the minutes? Did we approve them?
We're not there yet.
Okay. Any other public comment? Public comment is now closed. Minutes. Entertain a motion to approve the minutes from November 12th.
So moved.
Discussion. Next, we go on to appointments. Fair amount of appointments. Okay. If you look at the people there are the Aging Advisory Council, and almost those are all repeats. So we'll take them one at a time, okay? Joe Evans, one public member, applicant Joe Evans, and term expires 10/21.
I'll make a motion to appoint Joe Evans.
Any discussion? Any nominations from the audience? All in favor?
Aye.
Next is Patricia Spink. Same thing, 2/20/21. Applicant Patricia Spink. Any applications, any discussion? Any applicants from the audience? Okay. All in favor?
Aye.
Next is Kenneth Blair. Same thing, 12/20/21. Applicant Kenneth Blair. Discussion? Any nominations from the floor? All in favor?
Aye.
Peggy Younglove. Same thing. Any discussion? Any nominations from the floor? All in favor?
Aye.
Against? Dennis Peck. Any discussion? Any nominations from the floor? favor?
Aye.
Next one is Rick Seegers, 12/20/21. Applicant is Rick Seegers, current member is Rick Seegers. Here, a second.
Support.
Any discussion? Any nominations from the audience? All in favor?
Aye.
Next is Mr. Ken Price, 12/20/22. Different expiration date, and current member is Ken Priors, and he wants to go back to his current membership.
I'll make a motion to appoint Ken Price.
Support.
Discussion, any nominations from the audience? All in favor?
Aye.
We have 3 vacancies, which we will continue to have. So people volunteer. And then we have,
Yeah, Mr. Chair. Yeah.
I'm getting there. Okay, go around the track, okay?
All right.
Next is Megan Kaiser. Her new term expires 12/20/21. There's no applicant, okay, and there's no committee recommendation. That I don't know.
Point of order, Mr. Chairman.
Yes, sir.
I've been notified by the Director on Department on Aging that she's not interested in serving because she no longer works in Jackson County and cannot make the meetings.
Thank you, Mr. Chairman. Therefore, we just take her off the list. Correct? So, moving on. Lifeway's monthly report. Lifeway's here today?
Point of order, Mr. Chairman.
Yes, sir.
Lifeway's called and said they couldn't make it. They give their written report. If there's questions, please forward them to the Administrator Controller's office, and he will get the answers and then distribute them to all commissioners.
Thank you, Mr. Chairman. Medical care facility report.
Good afternoon. Okay, so before you should have a copy of our report. I'm going to focus on the finance area because I know that's particularly an area of concern. So I do want to go through the financials from August, September, and October. So for August, we showed a net loss of $199,000 for that month. That was mainly attributed to a dip in census due to the potential denial of payment for new admissions as a result of a survey. So if you look at the graph below, you'll notice a red box, or a little red bracket and a purple bracket. So that red bracket is the actual denial of payment period set forth by the state, and the purple bracket was the potential denial of payment set forth by the state. So how that works is when you have a survey that has not cleared yet, you enter this period of denial of payment for new admissions. And that's what happened to us in August. They had not returned until August 14th. And so during that period, we had the potential of not being paid for any new admissions. And thus, as past practice has held, we did not take any new admissions during that time frame. That caused the census for the entire month to be outside of the budget. So I wanted to explain that piece to you. For September, we did also have a net loss of $129,000. This we found has been an issue specifically with nursing wages. Previously, we had reported to you that we believe that it had to do with overtime. Upon further investigation, we found that the budgeting practices that were previously used did not account for holiday pay, step increases, or PTO accrual payouts, and we are fixing that for the 2020 budget. But that will probably continue to be an issue with overages and expenses for the nursing wages. Also, if you notice, the first part of that month, we were still dealing with recovery of the census from the previous month. And one of the things that we find is when we stop taking referrals for a period of time, it takes a little bit to get that faucet back on and running from the hospital to get those referrals consistently. And so we've seen that bleed into September just slightly. For October, however, you'll notice that we had a net income of $43,000. We had a $210,000 dollars better than budget on our revenue, and part of this was attributed to the change from the RUG system for paying for Medicare claims to the PDPM system, which is the patient-driven payment model. So what we've found with that is our average Medicare rate per resident per day for the month of October went from an average of $482 to $516 per day. And that was just in the change that the payment system created and how they look at the acuity or the challengingness of each resident to care for. I also wanted to draw your attention to the table on page 3. Page 4, that shows a 5-year comparison for our admissions and discharges. If you look at that table, you'll see that our number of admissions for 2019 have been substantially higher than all of our previous years. So we've worked really hard to continue to maintain that census with a lower length of stay that we're seeing in our resident population. Our AR days out remain at 45 days. For the people section, we have no outstanding grievances from the unions, and wage reopener negotiations have begun with 139 and M&A, 2 of our 3 unions. They are taking that to their membership, and that will be taken to the board on the 16th for their approval. And then in addition to that, I just want to point your attention to the grids called CNA call-in and mandation totals and nurse call-in and mandation totals. We have found that mandation has been a significant contributing factor in the past to overages in the budget. You'll notice that our call-in rate consistently remains higher than our rate of mandation or our requirement to make people stay over for additional shifts due to call-ins, which is a good sign. That means the staffing is there to support the residents without the need of mandating overtime for people. We are still ranked as a 3-star facility. We now have 4 stars in quality. That has increased 1 star since the last time I reported out to you. And that has to do with a recalibration in the star system that's taken out the measurement of short-term and long-term pain because they believe that measuring those areas are not really a good quality indicator of the quality of care that you provide and could potentially be creating more issues with the opioid crisis, so they've removed those from the criteria. And we remain 5 stars in staffing.
Practice, we had that same dilemma. You're paid based upon the patient's satisfaction. And I'm having a little bit of pain, okay, and so on, okay? They give them a big pain pill, okay, and so on. And then later on, then they're penalizing you for using the pain pills. So there's no way that you can make the patient happy so you can get a good evaluation.
Yeah, and so we're happy to see that removed just because there's some, you have to be very specific with the questions that you ask for that quality measure. And some homes are very specific and some homes have found unique practices for how they get that reported number, and so there's a lot of variation from home to home. And there's a lot of variation in how people perceive and feel pain as well, and that is also a major contributing factor to that. I also wanted to draw your attention on the last page to the quality projects that our quality team is currently working on. We are constantly working on quality and monitoring different areas, but these are the primary areas we're monitoring at the moment. I also wanted to draw your attention in the growth section to the change in our team leadership. So Julie Backus, who served as our social work and activities director for many years, has retired, as well as our maintenance director, Dennis Joseph, has also retired within this last quarter since reporting to you. So those positions required some new leadership to take place. Because Julie's position was 2 separate departments, that has been split up into 3 director positions total. And 2 of those 3 director positions are filled at this time. So just to kind of give you an idea, since 2018, January of 2018, there's only 2 remaining leaders that have remain through the transition on our leadership team. So we've had a lot of change in leadership, and so we've been working really hard to make sure that quality doesn't suffer, resident care doesn't suffer because of those things. In addition to that, on October 1st, we also changed therapy providers. We bid out that role, as it's been a contract role with us for quite some time, and we did make a change after 12 years to a new therapy company who started on October 1st, and that has been working very well for us at this time. Any questions that I can answer for you?
Thank you very much. Excellent report. Congratulations on getting your extra star.
Oh, thank you.
DHS quality report.
Good afternoon. Thanks for having me here today. I submitted a report that you should have received a week or so ago, and I don't want to read it to you, but I'll try to give you just a few updates. Our child care fund is changing the way that we work with state and county payments for children who are in foster care. And I don't know how much each of you knew about it previously, so I'll just give you a little bit. And just to let you know, our new fiscal year started October 1st, so we're still in the process of learning that new system. And once we have it sort of fully functioning and our budget is working month to month, we'll have a better idea for all of you in terms of budget allocations for future years. But previously, when children who are paid for in foster care through the county child care fund, previously the county paid the full amount, and then the state reimbursed the county 50% of that. Now, the state is paying first instead of the county, and so historically, the county budget has been for 100% of the cost of foster care, even though they would get 50% back. Now, only having to pay that 50%, that should help the budget moving forward. We are, again, the first year of it, still trying to figure out how it's all going to work and what our spreadsheets are going to look like in terms of payments and expenditures. So we're sort of in that initial process right now. And by the time we get to, I'm hoping February or March, what you start seeing on a month-to-month basis will be an accurate reflection of the amount that the county is responsible for.
So if a judge places a child in the program, and I'm using an umbrella of foster care.
Correct.
In the past, if they were out of formula, we had to pay 100% of that child care no matter what. So what happens to a child that's out of formula and state pay?
So, which would have previously been county child care fund?
On the county, correct. So what's going to happen now?
The county will pay, the state will pay first.
Automatically, even if the judge is out of formula?
Well, if the judge is out of formula.
You know, he changes sequence and steps the kid up and doesn't follow the normal process.
Oh, that's a good question. Because then the county was responsible for all of it without the reimbursement.
Correct. And one child could cost us a couple of $100,000.
Right. That's probably still going to happen if the judge is out of formula, but we've been really good about that. I don't think we have had
I
that.
know right now, but we're
Yeah.
looking at judges retiring, so could you, Deb, keep track of that, please? And get the answer on that, because that's how we end up with making a budget adjustment.
Yeah.
A big budget adjustment September 30th in the past, was if a kid's out of formula.
I don't think we have even had that in the last couple of years. And
We haven't.
And we will, I will tell you that we will work very preventatively if we have a change. We have actually specialized workers who work to make sure that doesn't happen as well. So, but my guess is that if it's out of formula, it is still going to be the 100%. Yes? Oh, sorry, that's not up to me. Next.
Will they be placed temporarily? Sometime. And I know there's a lot.
There's a lot, yeah. I can get that for you. I can put together a sort of simple step-by-step handout around that. There are federal guidelines, it really comes down to federal and state guidelines. Wording on a court order is very important, so the judges are very, very clear about the specific words that need to be used in order for it to get the funding that it needs. Also, not going outside the placement recommendation, which is, I think, what you're referring to.
I'm referring to, yeah.
We are bound to place with relatives or licensed foster homes. If a judge, for instance, there's a teacher that comes forward that is not related and not a licensed foster home, and the judge says, we're going to place you there, if that placement ends up being paid, it could be the county's full responsibility. So there's a couple of different ways in which that can happen, and I'll get you an easy to understand outline for how that can happen. Right, right. Governmental easy.
Yeah. It's a 3-inch manual, so we'll get you easy.
Okay. So all that to say, as we move forward into, I would, again, probably February or March of next year, we'll have a much better idea as to what the monthly costs are going to be now that the state pays first and the county only has to pay 50%.
Question, how much money do you think we'll be able to save per month? I mean, is this $20,000? Is it
I really don't want to guess because we don't know at this point. I mean, if you just look at what it was before, the county had to pay 100% and they got 50% back. I would say you're going to be saving about 50% of what you normally would allocate to us. But there's some payments that are happening that go back to last year still because we're still in that switchover time period. We'll have a much better idea in February or March.
Okay, thank you.
Yes. Universal caseloads, Jackson County is one of the counties in the state that has universal caseloads for our Medicaid, food assistance, and cash assistance cases. We continue at the state level to look at the sort of the efficacy of that system and whether it is truly the best system for the entire state. And I know there's a meeting actually coming up in mid-December at the state level to really take a look at, I think, whether this is a system that we stick with or should we be looking at something a little bit different and a little bit better. Also coming up in January of next year are the work requirements for Medicaid recipients. You may have heard that the state has now been joined or is joining other states in being sued around this work requirement. So at this point in time, we are still receiving information as if we are moving forward with that work requirement, but I understand there will probably be some court hearings between now and January 1st, and we'll have a better idea as to whether we maintain that requirement or hold off on it until the courts have made their decisions. But that's where it sort of sits right now. We're in the holiday gift-giving season for those in need in Jackson. We, on Saturday, had a semi-load of gifts for our children in foster care that were delivered, and those are in one conference room waiting to be handed out. And then we are in the process right now of our angel tree, accepting gifts for angel trees. So these are children who are on our food assistance caseloads whose families sent in requests. And the community, businesses in the community, individuals in the community buy gifts for certain kids that they're signed out for and bring them into our office. So our huge conference room on our first floor will be loaded with gifts by the end of this week for over 1,000 Jackson children. So we look a lot like Christmas in our office in these next couple of weeks, and it's just kind of fun to do something that's supportive to the community. We have a continuous need for foster parents and volunteers in our office. I think you've all heard me talk about foster parents before and our need for them, particularly for some of our more difficult to place children. We also, we provide medical transportation for adults who need a ride to get to a potential medical appointment that might be at University of Michigan or out of the county. We have a real lack of folks willing to do that at this point. So if you know of maybe a retired person who's interested in volunteering a little bit of their time and likes driving, they could volunteer for us. And then finally, I just always have, or as of late, have been attaching my list of meetings that either myself or someone in my office attends within the community and within our department. So if you have any questions about any of those involvements in the community, please let me know, and I'm happy to answer any questions you might have.
Questions, commissioners? Thank you, Zoe.
Thank you.
Appreciate it. Nice report. Veterans Affairs Semi-Annual Report. Anyone here for Veterans Affairs? MSU Extension Memorandum Agreement.
Good afternoon.
Good afternoon.
The agreement that you have in your packet is the standard agreement that we approve each year based on the budget that was approved for the county for MSU Extension in Jackson County, including the base assessment and the 1.2 additional FTEs of extension educators in agriculture and consumer horticulture that you provide us coverage for. Be happy to answer any questions that you have.
Any questions, commissioners? You have to accept this? Yes. Okay. Entertain a motion for acceptance, please. So moved. Any discussion? All in favor? Aye. Opposed? All right, thank you.
Thank you very much. Appreciate your support.
Health Department Monthly Report.
Good afternoon. One item for personal and preventative health relates to our laboratory. We do have a lab that provides limited services to do microscopic analysis for samples from our sexual health clinic. So that our lab was reviewed by Laura recently, and we obtained recertification. We're in compliance with the Clinical Laboratory Improvement Amendment Act under the Public Health Code. I have several items under environmental health. Couple items. First, to give you an update on the Sayers Road condemnation for methamphetamine. We did have, the owner had an industrial hygiene consulting firm, had been hired to conduct the required clearance sampling of that property. And as of today, you won't see this in the report, but we received notice that the sampling results show negative for methamphetamine, so that's good news. And once we get confirmation of that report, we'll be lifting the condemnation order. One big event that had happened over the last couple weeks is Arbor Ridge condominiums, where we experienced lead and copper exceedances. That is a 26-unit condominium complex. There was one unit that had tested above the 15 parts per billion. Second unit had a low level below the MCL, and there were another 3 residential units that were tested as non-detect. So due to that, we took several actions and several public health measures, one mainly being providing education and working with Department of Environment, Great Lakes, and Quality, and then also being available to provide filters for those that qualified for the filters. At this point, I can report that we haven't had anyone want to take advantage of the filters, and so we'll continue providing education as needed, but it seems to be the activity slowed down at this point.
A couple things that you won't see on the report that have happened since I submitted it. I've reported before on the Fisher Mobile Home Park, and we have heard from legal that they informed us that a pre-trial date has been scheduled within 2 weeks, and we'll be preparing for that. We believe it's because the circuit court is clearing cases that are still open at this point. So all the residents are out of that complex there, as you know, and our environmental health director, Don Haydock, will be consulting with Napoleon Township just concerning the blight conditions there. At this point, we don't see that it proposes any sort of public health hazard, but just want to be able to work with them to minimize any of the neighbors' concerns or anything of that nature. And then finally, just one other point about PFAS sampling. The state is now offering homeowners PFAS sampling kits through their State of Michigan laboratory. So individuals can purchase those kits at the cost of $290. So there are private laboratories offering the sampling as well, but there's no certification, if you will, that, those sample results are adequate and sensitive enough. But none of these homeowner sample kits are intended for regulatory compliance. It's just an option that the state's offering if individuals want to purchase the kit and test it on their own. We would receive results from the state if the individual reported that results are to be reported to the Jackson County Health Department. So I believe that concludes my report at this time, and unless you have any questions.
Just one,
Darius?
just a quick question. Where would we find more information on the PFAS test kits?
The PFAS sampling kits?
Sampling kits.
You can get them online through the state of Michigan. Don, do you know what the address is?
Not exactly, but if you go to the State of Michigan laboratory through MDHHS, actually, it's their laboratory, there'll be something online where individuals can order the kit. It'll get mailed to them. There's several bottles, including the blank samples, quality control. And again, it's not for regulatory purposes, but it's out there for folks. If there were a situation where there is a contamination site and the state gets involved because of that, and there are potentially impacted wells, the state's not going to require, those residents to pay up for testing. The state would come in and actually test those wells. So it's not always like that. This is like an interested, hey, I want to know if I have PFAS in my water because a half mile down the road is, maybe a dry cleaners or something like that.
You said that it's not going to be used for regulatory purposes, but if someone does it and sends it in and their level is high, then you said that they will report it back to you.
Correct, yeah.
And then what do you do?
So if it is reported back to the health department, we would take the measures that we did, much like in the Lomar facility, providing the education and providing any of that, and then continuing the sampling to determine if the levels, continue or become non-detect. Is there anything else I'm missing, Don, from those steps?
Well, we would, get access to.
Could you come up to the microphone, Don?
Pardon?
Could you come up to the microphone, please? 'Cause we got to get it on tape. Thank you.
A lot of times people say I have a big mouth. So yeah, in a situation such as that, we would perhaps we would get them in contact with the state toxicologists who can look at the result. If it's, make sure that there isn't any quality assurance problems, make sure that, look around in the surrounding area for any potential contamination sources. If they're in the middle of nowhere and there aren't any sources, well, perhaps some retesting would be warranted, something along those lines. So, when it comes to regulatory, at this point in time, there really isn't any regulatory compliance with PFAS because those rules are in the process of being made. It's not anticipated till springtime, but there are screening levels that are utilized at this point in time for actions. So that's kind of the situation at this point in time.
Any
I
other-
hope I answered the question.
Thank you very much for educating us in regards to that. Okay, moving on, Department of Aging, Marcy.
Good afternoon.
Welcome, Marcy.
Thank you. The first item on the agenda is a request to change a part-time, non-union position from outreach specialist to a MAP coordinator / outreach specialist. And some background on that, in 2006, the Part D component of Medicare began. That Part D stands for drug plan. And we hired a person to coordinate giving information to people who are on Medicare so they can make an informed decision regarding their Part D plan. Medicare, Medicaid Assistance Program, or MAP, also talks with people who are new to Medicare and they want information about supplemental insurance, the supplemental insurance that will cover the 20% that Medicare doesn't cover. Well, since Part D program began, and even with Medicare, there used to be Medicare A, B, C, and D. Now it's a different language, but it's A through G or H. It's gotten more complicated, in short. And looking at the person responsible to oversee the MAP program, I asked the Human Resources Department to look at her responsibilities and see if there should be an adjustment in wage, but also a different job description that includes more information about the responsibilities for the MAP program in addition to the outreach specialist responsibilities. And an outreach specialist, what that person does is go to people's homes and do in-home assessments to look at their particular needs and connect them with services. But the MAP coordinator is much more involved. And for example, a volunteer has to go to 5 days of training. The coordinator has to oversee 500 hours each year that they are volunteering in order to be qualified as a MAP counselor. During open enrollment that just ends, I think it's today, 482 people came into our office for an appointment for assistance to look at their Part D plan based on their current prescriptions, pharmacy preference. And over the course of a year, about $1 million is saved for people who come in and talk with a MAP staff person or volunteers. We do have 10 volunteers, and the coordinator oversees all that training, all that coordination. So the motion is to, requested is to change one Department on Aging, non-union part-time outreach specialist to a MAP coordinator / outreach specialist, classification grade I. Any questions?
Any questions, Commissioners? Lark?
When you say you're changing it from a non-union, is the new position union or a non-union as well?
It continues to be non-union. It's changing, because of the responsibilities, it's changing it from a grade H to a grade I, one step up.
Thank you.
Yep.
Any other questions for Marcy? Like to entertain a motion for approval, forwarding this to the board? All in favor? Aye. Against? Thank you, Marcy.
Okay, thank you, appreciate it. And then the monthly report, to follow up on an exercise class that we thought we needed to stop having in January called Enhanced Fitness. We found out that the grant amount was at a higher level than what we were originally notified, so we are able to have that exercise class continue. And also, for your information, Henry Ford Allegiance is starting a caregiver support group, and I have details in the report. So, all right.
Any questions
Anything
for Marcy? Thank you, Marcy.
Thank you.
Claims report. Entertain a motion to approve the claims. So moved. Any discussion? All in favor? Aye. Opposed? Other minutes? I don't see any other minutes. Okay, January reporting schedule. Okay. There's nothing for the January reporting schedule. Blake wasn't here. Okay. All right. So nothing on the January reporting schedule. Public comments. We're at the second public comment session. Each individual will state their name and have 3 minutes to address the board. You may only address the board once under this public comment opportunity and may not yield your time to others. Board members will not debate or answer questions at this time. Any public comment? Okay, public comment is closed. Commissioner comments? Yes.
If I could go back to the Child Care Fund for further explanation, on page 6 of the financial reporting under General Government Standing Committee, you'll see item 292, which is the Child Care Fund. It had a budgeted amount of money of $6.9 million and spent $6.9 million, awfully close, and it intends to spend its surplus. So just to make commissioners aware that it's about $7 million that we're dealing with there in the Child Care Fund, and we really need to pay attention to the foster care formula going forward, because it has in the past caused us some very difficult times at the end of the year, just so everyone knows.
Thank you, Mr. Chairman. Any other committee member comments? Entertain a motion for adjournment?
So moved.
Any discussion? All in favor? Opposed? Thank you.